Statistically, about 80% of patients who come in for just normal routine comprehensive eye exams have some symptoms related to dry eyes. And dry eye is much more complicated than just a dry feeling in your eyes that you're not making enough tears. It really is broken down into a couple of different segments. One is the segment in which there just isn't enough tear production. That actually is pretty rare. Much more common is what we call meibomian gland disease, which is a dryness in your eye because you're not making the right kind of tears. There's an oily tear that's made on your eyelids that is secreted sort of like an oil slick on water, and it prevents the watery type tears from evaporating. So if you're not making enough of the oily type of tear, you actually will tear to excess because the perception is by your brain that you're not making enough tears, and it kicks in and you overproduce tears. So you actually are tearing because you're not making the right kind of tears. Dry eye is a very complicated process and requires special examinations, and we have these available and recommend that patients come in for these specialized tests and where we can talk about these various treatments for this very common problem. What most people don't understand is that the tear film is really made up of two different kinds of tears. Let's use the analogy of a windshield and windshield wipers. If you don't have adequate windshield wiper fluid and you get something on your windshield and you turn on the wipers and hit the button to turn on the windshield wiper fluid and it doesn't come out or it's old, you'll get streaks in your windshield and it makes it very difficult for you to see to drive. Similarly, if you don't have the right kind of tears on the surface of your eye, even when you blink, you get this same smeary effect and it decreases your vision. And so the two types of tears are a watery tear that we all have when we cry, and an oily type of tear that comes from the tear glands that align along the eyelid margins on both the upper and lower lids. Now what that oily tear does is it covers up the watery tear to prevent evaporation, and so that you have a nice pristine surface just like you do when you have good windshield wiper fluid when you blink. Now those little glands along the eyelid margin can get plugged, and rather than being sort of a clear olive oil type of consistency, it can come out looking almost like toothpaste out of a toothpaste tube. And that smeary, thick secretion can really blur your vision. And so there are treatments that we have, both from the medical side of things, using omega-3s, and which in the form of fish oil is very helpful in breaking down that toothpaste-like secretion, and the use of mechanical types of treatments that we have in the office, LipiFlow specifically, that helps to squeeze those glands, remove that material, reset the gland while generating some gentle heat to make your eyes feel good at the same time. And all of those things are very helpful in creating this kind of a smooth type of tear that will create a nice smooth surface like what you would have on a windshield after windshield wiper fluid, or a better analogy is even using a Zamboni going over the ice to create a nice smooth surface on the ice after in between periods of a hockey game.